Acute pharyngitis is an pediatric disease, communicable disease. Look at this picture, shows that clinical examination of pharynx or throat. This picture shows that viral and bacterial fungal pharyngitis. Detail going on. Introduction. Acute pharyngitis is a common inflammation of pharynx leading to a sore throat and discomfort. It can affect individuals of all ages with a higher prevalence in children and young adults. Pharyngitis can be caused by various pathogens including virus and bacteria, or result from non-infectious factors like allergies or irritants. Understanding its causes, types, and management is crucial for effective treatment and prevention. Definition. Acute pharyngitis is defined as the rapid onset of inflammation of pharyngeal tissues, which includes the tonsils, uvula, and soft plate. It is characterized by throat pain, redness, and swelling, often accompanied by fever, cough, and other systemic symptoms. Types. 1. Viral pharyngitis caused by virus like adenovirus, rhinovirus, coronavirus, influenza, and Epstein-Barr virus. Viral pharyngitis is the most common type and usually resolves on its own. 2. Bacterial pharyngitis caused primarily by group A streptococcus, leading to streptococcal pharyngitis or strep throat. Other bacteria like Mycoplasma pneumonia and Chlamydia pneumonia can also cause pharyngitis. 3. Fungal pharyngitis, less common, often seen in immunocompromised patients, caused by Candida species. For non-infectious pharyngitis caused by irritants such as smoke, pollution, or allergens, or by condition like gastroesophageal reflux disease. Causes. 1. Viral infections. The most common cause includes cold and flu viruses. 2. Bacterial infections, mainly caused by group A streptococcus. 3. Fungal infections, often due to Candida species in immunocompromised individuals. 4. Allergens and irritants such as smoke, pollution, and chemicals, and other factors. Trauma to the throat, excessive use of voice, dry air, or underlying conditions like GERD. Risk factors 1. Age. Children and young adults are more susceptible. 2. Close contact. Crowded living conditions, schools or daycare centers increase the risk of transmission. 3. Weakened immune system. Individuals with compromised immunity are more prone to infections. 4. Smoking and alcohol use. These irritants can damage the throat lining and increase susceptibility. 5. Chronic conditions. Conditions like allergies, GERD, and sinus infections can predispose to pharyngitis. Complications 1. Pretonsillar abscess, a collection of pus beside the tonsil, leading to severe pain and difficulty swallowing. 2. Rheumatic fever, a serious complication of streptococcal pharyngitis affecting the heart, joints, and nerve system. 3. Post-streptococcal glomerulonephritis, a kidney disease following a streptococcal infection. 4. Otitis media, infection of middle ear, particularly in children. 5. Sinusitis, inflammation or infection of sinuses. Pathophysiology, infectious agents, allergens, irritants enter into pharynx, leading to an inflammatory response. This response involves the release of cytokines and other inflammatory mediators, causing the symptoms of pharyngitis. In bacterial causes, especially with group A streptococcus, the bacteria can release toxins that further aggravate inflammation and can lead to systemic complications like rheumatic fever. Pathophysiology of acute pharyngitis. Step by step. 1. Exposure to pathogens or irritants. 2. Entry and colonization. 3. Initiation of the immunoresponse. 4. Release of inflammatory mediators. 5. Inflammation and swelling. 6. Phagocytosis and pathogen elimination. 7. Toxin release in bacterial pharyngitis. 8. Tissue damage and pain. 9. Symptom manifestation. 10. Resolution or progression. 11. complication, if any. In some cases, complication. Signs and symptoms. 1. Sore throat. The primary symptom, often severe. Second, red and swollen throat. Visible inflammation of the pharyngeal tissues. 3. Fever, common in bacterial and viral pharyngitis. 4. Swollen lymph nodes, particularly in neck area. 5. Difficulty swallowing due to pain and swelling. 6. Cough, more common in viral pharyngitis. 7. Headache and malaise, general feeling of being unwell. 8. Exudate, white or yellowish patches on the tonsils, more common in bacterial pharyngitis. Diagnosis. 1. Clinical examination. Observation of symptoms and physical examination of throat. 2. Rapid antigen detection test or ADT, quick test for group A streptococcus. 3. Throat culture, the gold standard for diagnosis bacterial pharyngitis, especially if RADT is negative but suspicion remains high. 4. Complete blood count may be used to differentiate between bacterial and viral infections. 5. Monospot test for diagnosis Epstein-Barr virus EBV if infectious mononucleosis is suspected. Nursing diagnosis. 1. Acute pain related to inflammation of the pharyngeal tissue. 2. Impaired swallowing due to throat pain and swelling. 3. Risk for infection related to a weakened immune response. 4. Hyperthermia related to infection. 5. Risk for dehydration due to difficulty in swallowing fluids. 6. Knowledge deficit related to the prevention and management of symptoms. Disease management. 1. Symptomatic treatment includes analgesics like acetaminophen or ibuprofen for pain and fever relief. 2. Hydration. Encourage fluid intake to prevent dehydration and soothe the throat. 3. Rest. Adequate rest to help the body fight off infection. 4. Salt water gargle helps reduce throat irritation. 5. Antibiotics for confirmed bacterial infections, especially with group A Streptococcus. 6. Antiviral medications may be used in special causes of viral infections like influenza. 7. Humidification, using a humidifier to keep the throat moist and reduce the discomfort. 8. Avoid irritants such as smoking and exposure to pollutants. Treatment. 1. Antibiotics. Penicillin or amoxicillin is commonly prescribed for bacterial pharyngitis. Alternatives include cephalosporins or macrolides in case of penicillin allergy. 7. Antipyretis and analgesics for fever and pain relief. 3. Corticosteroids may be used in severe cases to reduce inflammation. 4. Surgical intervention rarely needed except in case of peritonsillar abscess. Psychosocial medicine. 1. Emotional support. Patients, especially children, may feel anxious or distrusted due to symptoms or complications. 2. Patient education, teaching patients and caregivers about proper medication use, symptom monitoring, and when to seek medical attention. 3. Social isolation. In case of contagious infections, patients may need to stay isolated, which can affect their social interactions and emotional well-being. Prevention. 1. Hand hygiene. Regular hand washing to prevent the spread of infections. 2. Avoid sharing personal items such as utensils or drink with infected individuals. 3. Vaccination for preventable viral infections like influenza. 4. Healthy lifestyle, a balanced diet, regular exercise, and adequate sleep to strengthen the immune system. 5. Avoid smoking, reduces the risk of irritant induced pharyngitis. In conclusion, acute pharyngitis is a common condition with variety of causes, particularly viral and bacterial infections. Prompt diagnosis and appropriate management are essential to prevent complications and ensure a quick recovery. Prevention strategies like good hygiene, avoiding irritants, and vaccination are crucial in reducing the incidence of pharyngitis. Thank you. Have a nice day.